So I'm gonna start sharing the screen. Where is it? Here. Good. Okay. So to start with the abdomen, we're gonna start with the abdominal wall for today. We're gonna have quite a lot to talk about it, but a lot of it is theory. But I will tell you like what you're gonna need to know in order to cover your practical part, and then I will tell you what you need to focus for your theoretical part in the exam period. All right. So before I start with the abdominal wall itself, so we're gonna need some really basic stuffs to uh, get a general idea about how we are gonna divide based on the superficial lines on the body, to like how we are gonna divide the abdomen to different regions. So in the clinical practice, then we can actually use these regions in order to, if you want to have a report, let's say about a abdominal pain from your patient, so you know how to have the report properly, you can address it properly. So first we're going to go over these divisions of the abdomen to different regions, and then we're going to move it down to the abdominal wall itself. So the very first page of the note, I wrote about, I mean, I wrote a summary about the regions and planes of the abdomen. So there are two different ways that we can actually uh, divide the abdomen into different regions. Either we're going to use four different planes to divide the abdomen into 9 different regions, or we're going to use two other lines or planes to divide the abdomen into 4 quadrants. Okay, so we're going to talk about each of them one by one. Let's get started with the more detailed stuffs over here. So if you're looking at this, let's say model over here, so we can find 4 different lines. So basically, you can use the 2 mid-clavicular lines, which are just running down, and these lines are going to be passing through the mid-inguinal points. Means if you're running from the anterior superior iliac spine all the way toward the pubic symphysis, so halfway between them is the mid-inguinal point. So these are the two sagittal planes or lines that you can use in order to give the divisions to the abdomen. From the other side, there are two other horizontal planes that we can use to help us with the divisions actually. So the very first plane, which is horizontally running, is called as subcostal plane, because this line is passing right under the costal cartilage of 10th rib, or basically 10th costal cartilage. Why? Because this guy is the last costal cartilage, and this is the one which is going to form the costal margin. Then later on, it will be joining with the other costal cartilages, right? So then we get to have the subcostal plane, and this guy is passing at the level of L2, all right? So subcostal plane is the first horizontal plane for us. And then more inferiorly, you can use a plane called transtubercular plane. It means that it's transecting the tubercles of iliac crest. So basically, you get to have the anterior superior iliac spine. You just run few centimeters, like 3, 4, or 5 centimeters posteriorly. Then you're gonna reach to the tubercle of the iliac crest. Okay. From there, you can just make a horizontal line passing toward the opposite tubercle of the iliac crest. So in that case, we will have the transtubercular plane. All right. And this guy is going to be located at the level of L5. So with the help of 4 different lines, you could actually make 9 different regions in the abdomen. So the regions that we are going to see in the center, so above the subcostal plane and between 2 mid-claviculars, you have the epigastric region. For example, if someone is having acid reflux from the stomach or any stomach related pain, usually you can feel it here in the epigastric region, all right? That's the usual case. I mean, I'm just saying it as really basic stuffs, okay? Below the epigastric region around the umbilicus means between two horizontal lines and between two sagittal lines that we have the umbilical region, since you're around umbilicus. And then since you're going down closer to the pubic region or toward the pubic areas, so then you actually have the pubic region, which is located below the transtubercular plane. Now on the sides, if you see, there are three other regions at each side. So they are paired regions. So on each side of the epigastric region, you call these regions as hypochondrial regions, okay, or hypochondrium. So you have the right hypochondrium on the right side, and you have the left hypochondrium on the left side. So every abbreviation is written down here, okay? Then from the other side, next to the umbilical region on each side of it, since you're actually at the very sides of the abdominal wall, so you have the right lateral and left lateral, or in the other name, you can say right flank and left flank. These are the ways that you can call out these regions. And then inferior to the flank region, so below the transtubercular line, you get to reach to the inguinal region. So basically, you're going to have the left inguinal and right inguinal regions. All right. So these are the ways that we can get to have 9 different regions on the abdomen. Now, if you get the basics, some other doctors, maybe they would like to use some other transverse planes instead of subcostal plane and also the transtubercular plane. So if we go on the skeleton of the body over here, so down here you can see the subcostal plane passing right under the 10th costal cartilage, right? But now you can do another thing to use, for example, another plane which is a bit above the subcostal plane, somewhere like here. So I'm going to show you. So here's a subcostal plane. You can use another plane which is located at the level of L1 vertebra, another horizontal plane, instead of the subcostal. This plane is called as transpyloric plane, because if you have the esophagus over here, then you have the stomach. So the terminal part of the stomach, let me bring it down. Here's a transpyloric. Okay. Oops, not good. Okay, somewhere like this. Here it is. So then if you have the stomach over here, you can make a horizontal line, or you can make an imaginary line which is passing through the pylorus of the stomach, which is a terminal part of the stomach. So this plane is called transpyloric plane, and that's located at the level of L1. All right, so instead of the subcostal, you can actually use the transpyloric plane. So it just depends what you like more. The good thing with the transpyloric plane that they use is that there are some certain structures that are located in that region. I mean, I made a list over here, but I'm not gonna go over them because we haven't covered it. For example, a part of the gallbladder called fundus of the gallbladder is over there. Neck of the pancreas is there, and a bunch of other structures that later on, bit by bit, once we are going more deep into the details of the abdomen, those specific structures will make sense to you. All right, so I don't want you to memorize this part of the note right now because it has no use. You're just gonna forget it. So this was pretty much about the transpyloric plane. So basically, you either use the subcostal or you use the transpyloric plane. From the other side, we said that we can use the transtubercular plane. Another way, you can find the anterior superior iliac spines, and you can just make an imaginary line crossing the anterior superior iliac spines, and you can call it as interspinous plane. So instead of the transtubercular, you can use the interspinous plane. All right. So that's pretty much. But still, the name of the regions are the same. It's just about, let's say, what you like, or some other physicians prefer to use other planes other than the subcostal or the transtubercular. All right. Just give me 1 second, please. All All right. Okay, good. So these were the 9 regions that we could define over here. Another easy way to make subdivisions on the abdomen is basically just to form quadrants, which is really easy way, like usually when you're doing the clinical studies, let's say about the internal medicine, especially in the gastroenterology and so on. For example, if anyone has any complaint about, let's say, about the liver or about the gallbladder, so they would be feeling the pain over here. So basically, instead of saying or using the hypochondrium and epigastric region, so you can form larger regions. So in that case, what can happen is that you have an easier way to express, let's say, the location where the pain is located. So basically what we can do is just to use the median plane of the body, and then you can use another plane which is running horizontally through the umbilicus, and that's called as transumbilical plane. This is located at the level of the intervertebral disc between L3 and L4. So over here, if you see between L3 and L4, somewhere here is the location of the umbilicus, and that's where you have the transumbilical plane. So by help of these 2 planes, we have right upper quadrant, left upper quadrant, right lower and left lower quadrants. Okay, so let's say if anyone has, for example, let's say pain from the gallbladder, so then you can just say pain in the right upper quadrant, or that's what you're going to read in the different books or different notes later on. So keep it as basic and simple. So in everything, in every, let's say, quadrant, like everything is written down here, that what you can find there, but don't waste your time on memorizing these right now, because it's just going to be painful. All right, so make sure you know the basics, you know the major planes, you know how to divide the abdomen, you know the name of the regions, and that's more than enough for now. Then bit by bit, when you're learning the organs and when you learn where the organs are located, then you can just say it, what's located where. Okay, so do not really waste time, especially right now, on these 4 tables, because you're gonna learn them anyways, but it's better to learn it bit by bit. All right, so now let's make it to the abdominal wall. So basically, we can divide the abdominal wall into 3 major parts. Like you can have the posterior abdominal wall, you can have the lateral abdominal wall, and you can have the anterior abdominal wall. About the posterior abdominal wall, later we will talk about it. So now what's gonna be dissected is the anterior abdominal wall. Basically, in the easy way, in the book, it calls it as anterolateral abdominal wall. Why? Because first of all, lateral and anterior abdominal wall, they are continuous with each other, and you cannot find a sharp border between them. So over here, if you see in this cross section of the body, as you're looking at it, it says the boundary is indefinite and overlapping. So basically, you cannot really define a proper border between the anterior and lateral abdominal wall. So make your life easy, and you can call it as anterolateral abdominal wall. The abdominal wall, somehow it's kind of close to what you learned about the thoracic wall. I mean, mostly in the case of the muscles, but still there are some major differences. So basically, the abdominal wall is formed by the skin, subcutaneous tissue, the muscles, and the fasciae, which are related to it. All right, but still, as we are running from superficial to deep, okay, so let's run more on the lateral side, somewhere here. So what you're going to be able to find is the skin, the fat, which is the subcutaneous tissue. So on the sides, you can find 3 muscles, 3 layers of muscles. These are pretty much same as the intercostal muscles that you had. So over here, the first one is external oblique muscle of the abdomen. Second layer is internal oblique. There is no innermost, okay? So there is only internal oblique. And then the third layer is gonna be the transversus abdominis muscle. Like in the thorax, you had transversus thoracis muscle. Then as you're running deeper, so if you're passing by the skin and all these muscular layers and their fasciae, which are associated with them, if you go deeper and deeper, you get to reach to a cavity in the abdomen where you have, let's say, the parts of the GI tract located there. So then this cavity where you find over here is called as peritoneal cavity. So it's pretty much same as the pleural cavity, like the pleura and pericardium, what you were learning. In the abdomen, you have the peritoneum. So again, same as the pleura and pericardium, peritoneum has a parietal layer. As you see, it's lining on the most of the areas which are related to the abdominal wall. So this is a parietal peritoneum that I'm outlining over here. Okay, this is all parietal peritoneum, all right? So then there are certain structures, for example, stomach and spleen, that almost completely they are covered by the visceral layer of the peritoneum. I mean, the peritoneum is a bit more complicated in the abdomen because of the numbers of the organs and structures in it, and especially the things that happen during the development, it makes it a bit more complicated. So once you do the embryology of the peritoneal cavity, like in the exam period, then that's the time you're gonna learn it properly. So right now, I'm just gonna give you some basics. I mean, not now, in the next lesson. So now, I just wanted you to know that there is some certain layers that you need to learn them one by one. So we're gonna run from the skin to subcutaneous tissue, then 3 layers of muscles that you will see them all, and then some associated fasciae, and then parietal peritoneum, that's the last person, and then you will actually enter into the peritoneal cavity. Okay, so let's see what we've got over there. I'm gonna move down here. Good. So what we're gonna find is that we have a cut on the abdominal wall, so we are looking more on the lateral side of the abdominal wall. All right, since we said that we call it as anterolateral abdominal wall, so we take them as one. So you get to have the skin and the subcutaneous tissue. So what you keep in mind is that the subcutaneous tissue, which is basically the fat, there is few things that you need to know about it, especially in the case of the abdomen. So let's say if you have the umbilicus somewhere over here, so above the umbilicus, the subcutaneous tissue, the fat, what you get to have deep to the skin is pretty much same as everywhere else in the body. Below the umbilicus is where that the differences are coming. So basically, below the umbilicus, the fat, what we have, like there, so basically the subcutaneous tissue has a fatty layer. All right, so let's see over here. You see this is square. We're gonna move it down and we are looking at the whole thing from superficial to deep. Okay, so here's the skin, then here's the fat, so basically the subcutaneous tissue, then those 3 layers of the muscles. You see, so we are going in this way, in this direction. And then until we are getting to the peritoneal cavity, this is where we have the, let's say, organs of the GI tract. So now, the thing is that, as I said, below the umbilicus, well, deep to the skin, you have the fatty layer. You have the certain amount of fat, which is variable in different people, depends like if someone is more skinny or if someone is like having more amount of fat. So this fat, which is deep to the skin, is called as camper fascia. Okay, they love it. They will ask you about it for sure. And the thing which makes the subcutaneous tissue of the abdominal wall different from the other places is that right on the posterior surface or on the deep surface of this camper fascia, which is the fat, there's this black color, which I'm just lining over it. Okay, so there is a layer of basically elastic and collagen fibers, which are quite dense, and they are over here to support and keep the fat properly in place. And that layer, it's actually called as scarpa fascia. Okay, so you have a fatty layer and you have a membranous layer. So fatty, the subcutaneous tissue, then the fatty layer is basically the camper fascia, and the membranous layer is scarpa fascia. So remember it like MS. And the thing is that this scarpa fascia, so it's running down the whole way, and later on in the perineal region, which is gonna be taught you in the pelvis, this guy is just gonna be continuing down toward the pelvis and perineum, and there is gonna be called as colles fascia or superficial perineal fascia. I just tell you right now just to hear it, okay? So you don't need to focus on it so much because later on you're gonna get to know it properly. So then we talked about the first two layers of the abdominal wall. So then the skin, then the fatty camper fascia, and the membranous scarpa fascia. Now, if you see, so deep to the subcutaneous tissue, we're gonna have three layers of the muscles. So these are the flat muscles, which are the oblique muscles. So external oblique, internal oblique, and transversus abdominis muscle. So the thing is that once you're talking about these muscles, then you know that there is a fascia basically covering the muscles, which is called as investing fascia. Okay, so pretty much the same as investing layer what you had in the neck, which was covering the muscles. So again, you have this such a thing over here. So since you have three layers of muscles, then you have three layers of the investing fascia. So over the external oblique, you're gonna have this superficial layer of the investing fascia. Over the internal oblique, you're gonna have the intermediate layer of the investing fascia. And over the transversus, you're gonna have the deep layer of the investing fascia. So three layers of investing fascia we've got associated with the three layers of the muscles. Okay, so as you see, we are running through the depth of the abdominal wall, and we are almost reaching to the peritoneal cavity where you have the GI tract. So then I just told you earlier that as we were looking at this cross section over here, so we talked about all these fasciae and all the skin and everything. And as I told you, over here you have got the parietal peritoneum. So still, there should be something between the transversus abdominis muscle and parietal peritoneum. So on the posterior surface of the abdominal wall, like behind all these muscles, like deep to these muscles, you remember in the thoracic cavity you had endothoracic fascia, like covering the whole internal surface of the thorax. So then over here, you basically have the endoabdominal fascia, okay, which is running out the whole way, let's say, toward the, let's say, posterior abdominal wall, lateral and anterior. So endoabdominal fascia is the next layer after transversus abdominis muscle. But as you see, throughout the course of the fascia, well, in a big part, endoabdominal fascia is actually covers the internal or deep surface of the transversus abdominis muscle. That's why throughout the most of the course of the endoabdominal fascia, you call it as transversalis fascia. Okay, you call it as transversalis fascia because it's covering the inner aspect of the transversus abdominis muscle, but still it's the endoabdominal fascia. You just call it in that way. All right, so don't really get confused with it because it's the same thing. All right. So if we are looking at this sagittal cut, so once you get to see the transversus abdominis muscle, then this layer deep to it is going to be the transversalis fascia. Over here you can see it, or endoabdominal fascia. And then again, deeper to the transversalis or endoabdominal fascia, you have another layer of the fat. Since this is out of the peritoneal cavity, so this is called as extraperitoneal fat. And then lining the deep surface of the extraperitoneal fat is done by the parietal layer of the peritoneum, you see? So this is the one. So once more, from superficial to deep: skin, Camper fascia, which is the fat; Scarpa fascia, the membranous layer of the subcutaneous tissue; 3 layers of the muscles: external, internal, oblique, transversus abdominis; 3 layers of the investing layer: superficial, intermediate, and deep. And then you have the endoabdominal fascia, or basically transversalis fascia, extraperitoneal fat, and parietal peritoneum. So this is what you have to name as the structures forming the abdominal wall. So they will ask you, what is abdominal wall? So then now you know it. You know how to talk about it. So make sure you're gonna learn this drawing, because this is the best shot you can have to draw for your examiner and just impress him or her, and then you can just play around with the whole thing, and then you can just show a bunch of structures on the cadaver and you're gonna be done basically. Let me see. Okay, we still have time. So these were the major layers of the abdominal wall. So over here, so I made the summary of the book about the layers or the structures forming the abdominal wall, about the fasciae of the abdominal wall. So everything is actually mentioned over here. Just one more thing to mention is about the attachments of the abdominal wall, or basically about the borders of the anterior abdominal wall. So anterior abdominal wall superiorly starts from, or let's say its superior border is going to be the 5th, as I wrote over here. Let me show you. All right, there we go. Sorry, superiorly it's bordered by the 7th to 10th costal cartilages, and also the xiphoid process of the sternum. So that's the superior border of the anterior abdominal wall. And inferior border of the anterior abdominal wall is going to be done by the inguinal ligament, the iliac crest, so basically the anterior superior iliac spine, and then the iliac crest itself. And more medially, you're going to have the pubic crest and upper part of the pubic symphysis, which is going to be forming the inferior border of the anterolateral abdominal wall. All right. So you can start with the borders, then you go with the general structures, then the fasciae, which we talked about them. And then we're going to now talk about the muscles more and more. So basically, in the abdominal wall, you've got 5 pairs of muscles. Okay, so 5 on each side. You have 3 flat muscles and 2 vertical muscles. Flat muscles are mostly located on the sides, just to make it easy. Vertical muscles are located near the midline. Okay, so near the midline. So just keep it in mind in this way. Now, what we're gonna have here is that after the skin and the subcutaneous tissue, so you have the very first layer of the muscle, which is the external oblique muscle. As you see, it has attachments to the ribs itself. So let's say from the lower 7 ribs, we have the attachments of the external oblique muscles. I haven't seen anyone asking the attachments of these muscles. So even for, if you want to learn it, do it in the exam period. Right now, you just have to learn how to show the external oblique. All right. So that's the origination of the muscle. And as you see, the fibers are running down vertically, inferomedially. So external oblique muscles, remember, they are pointed toward the external genital organs. Like that's an easy way to learn it, all right? The inferior attachments of the muscle is to the iliac crest, anterior superior spine. And the thing is that the inferior margin of the muscle is going to form the inguinal ligament. So basically, we knew that the inguinal ligament attachments are going to be the anterior superior spine until the pubic tubercle. Okay, so these are the major attachments of the external oblique muscle. But something which is happening with these muscles is that you don't get to have the muscles all the time. Okay, so after some course, the muscles are actually going to be replaced by what? By aponeurosis. Okay, so basically the investing fascia which is covering the muscles, then they will extend toward the midline to form the aponeurosis of the muscle. So here you have external oblique muscle, here you have external oblique aponeurosis. All right, so basically in the case of the external oblique muscle, it's generally the aponeurosis of the muscles start at the level of the mid-clavicular line, and more specifically with the external oblique muscle, to be more accurate. So aponeurosis starts from the mid-clavicular line, and another line you can draw. If you can draw a line to connect the umbilicus toward the anterior superior iliac spine, you call this line as spino-umbilical line. So as you see that you're going to have the external oblique aponeurosis to be started from the mid-clavicular line and spino-umbilical line. Okay, so basically the inguinal ligament is formed by the inferior free margin of external oblique aponeurosis. And you can still see that the other attachments of the aponeurosis is going to be running toward the midline. Later we will talk about it. And also it has some attachments to the upper surface of the pubic crest and pubic symphysis as well. Okay, so this is pretty much about the external oblique muscle. From the other side, if you cut off the external oblique, you're going to get to have the internal oblique muscle, which the fibers are running almost 90 degrees of angle to from what we had on the external oblique. So they are running supermedially. Again, pretty much same as the external and internal intercostal muscles. So this guy arises from the iliac crest and a fascia at the back called thoracolumbar fascia, and it inserts the lower ribs. So let's say the 10th to 12th ribs, you have the attachments, all right? And then again, from the mid-clavicular line, you're gonna have the aponeurosis of the internal oblique muscle replacing the muscle itself. So easy stuff, nothing hard about it. Now, if we cut off the internal oblique muscle, we're gonna get here, which is the transversus abdominis muscle. So as you see, the fibers are running more transversely, right? So transversus abdominis also arises from the iliac crest. It has attachments, let's say, to the lower ribs and also to the thoracolumbar fascia, which is the fascia at the back. And again, toward the medial side, it's going to be replaced by the aponeurosis, so transversus abdominis aponeurosis. So each muscle, each of these flat muscles, each of these three layers, they form their aponeurosis. Okay, so if I show you on the application over here, here you have the external oblique and the aponeurosis. We go down to the next layer, internal oblique, and its aponeurosis. Again, we go down, you get to see the transversus abdominis and again the aponeurosis. So this is happening everywhere, all right? Good. So I've got the notification for the, like, I don't know, last 10 minutes. I'm gonna pause it right now and I will send you the new link right now again. Like